I would like to, at this time, introduce Mr. Steve Smelski and Dr. Sandra Gompf to talk to us a bit about what Dr. Sharon just mentioned, both of their foundations and what they're doing collectively to raise awareness as well. So, Mr. Steve Smelski, Shelley, are you going to join him? Okay, all right.
Thank you, Donna. So, Sandra and I get to share the stories of our boys, which if you look behind us, you'll see we've got banners this year, so you get a good idea of Jordan and Phillip. Shelley and I had a very difficult time after Jordan passed, and I think it took us about 2 months to decide to go ahead and start the foundation because it gave us something to focus on. It took us a little while to get going, but through the good partnerships from the different entities involved here today, we actually have a good story to share. When we started out, our idea was to try and save a child's life, and we were worried we might not ever know that. And I can happily say today that's not so. We do know, and that's awesome. But as everyone has said before, there's a lot more work to do. So I usually go into a story about what happened to Jordan. I was going to cut it a little bit short today, but I realize for those of you who don't know Jordan's story, you can't share it with anybody unless I tell it to you. So I'm going to go ahead and start, and then Sandra is going to share Phillip's story. And I think you'll get a little idea of what we've had to go through. Can we go ahead one slide, please? This is our son, Jordan. He graduated the 5th grade in 2014, and we went to Costa Rica for our second trip to Costa Rica for vacation that summer. We had a very busy schedule, but we only swam once, and it was in this pool. They say it's rare, but we only swam once. And the headache started a couple days later. The vomiting started on day 4. The next day we took him to the emergency room. And there's the timeline. I won't go through it in detail. But you can see it happens very quickly. And it looks like a lot of different things. And as a parent, you always think, well, it's just the flu. He'll be better by morning. Well, he wasn't better by morning. He got worse. And he got worse every day. So you don't have very much time as a parent to react, to get your child to the hospital, to try and save their life. I can say Shelley and I know a lot more about Naegleria and primary amoebic meningoencephalitis now than we did then. We had cases here in Orlando in 2007. We knew about the cases. We knew the amoeba was in the lakes. And I don't think Shelley and I ever went out on Google and actually Googled amoebas to see what we were dealing with. And that is the one thing I wish we had done, because then maybe we would have known it was in hot spring water. So looking back, I would say that's the one thing that we wished we had done. And I can tell you as a parent, a lot of days you want to go ahead and look back and say, man, I wish I had done something different that day. But power, or knowledge is power. So that's why we share it, because most people don't know. And we don't want anybody to have to go through what we've gone through. Can we go to the next slide, please? So primary amoebic meningoencephalitis, I remember when we first found out, we couldn't even pronounce it. I guess I still can't. But everybody says it's very rare. I mean, you see it on TV, and every doctor will go on TV and say it's very rare. However, it's not if it's your child. It's very real. And when you only swam once, you're like, wow, how rare can that be? then it's just a couple of four-letter words to us. So this is one of the things we've been focusing on, is trying not to call it very rare, because then nobody really listens and nobody learns and nobody will go check it out and nobody will try to find out the facts. We're worried that people expose their children a lot more than they should. So I thought what we'd do is share some of the things that we've been focused on over the last year. We've been working with Florida Hospital for Children and Dr. Whitehowen and his team to change the care pathways. He mentioned that somehow we have to figure out how to treat or begin treatment immediately, because that's what it takes to defeat this. Jordan died in 7 days and 12 hours after swimming. Many of the timelines are the same. It happens very, very fast. And you could waste 3 or 4 days thinking it's the flu before you even react as a parent. So we do have to figure out how to start the treatment immediately. We also need to be able to detect it very early, which means education and better ways of identifying it. It's not notifiable in 47 states. So there's a map that the CDC has. They'll show you the different cases, and most of them are southern tier, except for Minnesota, which is right up at the top, and they've had 2 confirmed cases. If it can happen in Minnesota, it can happen anywhere. So our fear is there's other cases, maybe many other cases, that aren't reported because they don't have to be reported. And nobody really knows that it's out there. A lot of deaths are unconfirmed. So we'd like to get that changed. We've been working with the Gompfs to try and start a petition to change that. We need to stop calling it rare, which I've already talked about, and then we don't really know how many cases there are each year. We would like to do some research in that area, and that's why we started the foundation, is to raise funds. And that takes help from everybody to get the information and get to the right facility to help us with the research. But there is research that we do want to fund through the foundation. And then we also have to work with to educate the medical communities as well as the parents, because as a parent, if you knew it was there and how bad it could be, maybe you'd change your mind. Next slide, please. So I just put up a couple bullets here that we've learned over the last a little over a year and a half that we've been pursuing this. Timeline's almost the same on every case. We've talked to many of the parents, and we'll sit there and nod our heads in agreement when you realize just how very similar the cases are. So it's very methodical, it's very quick. The amoeba is a very tough opponent to try and overcome. Early in the infection, it can look like viral meningitis, and then just a day or two later, it can look like bacterial meningitis. Before it looks like viral meningitis, it looks like the flu. So you can see how difficult it is to identify, and then to know that you have to start treatment immediately. That's very difficult to do. When his patient's brought into the ED, usually CSF samples are taken, and we try and identify it from that. We need to develop better ways to identifying it early. Early detection can lead to a positive result, which you'll hear about later today. Next slide, please. So we also identified a few things that still need to change. We do want to try and make it nationally identifiable or notifiable. We also need to have the drug Impavido on hand, very close. You need to start it. Every minute counts, so you need to start the treatment as soon as possible. Usually the press will sensationalize things. However, in this case, they actually have it right. It is the brain-eating amoeba, and therefore every minute counts. Care pathways need to be changed. We need to be able to have alerts to identify it. That's why we're working with Florida Hospital for Children. We need ongoing continuing education. We need it for the ED physicians. We need it for the lab technicians, because if you can't identify it, very hard to start treatment early. If it's determined that the patient is presented with meningitis, need to ask about freshwater exposure. That needs to be automatic. Now, if you look at the freshwater exposure, you think swimming in a lake or a river. Some people don't think about public water systems. So you almost have to ask any type of fresh water up the nose, because some people have died from neti pots, which was in the house from public tap water. So there's still a lot of work to do. There's a lot of things that we have to do. Next slide, please. So PAM is 97 to 99% fatal. And it started to come down because of the case we're going to talk about today. We'd like to see that get down below 50%, and that's going to take work on our part. And we need your help to do that. And that's why we've assembled this group today, share knowledge, and this year we're going to change the program a little bit, and we're going to come up with some tasks to work on over the next 12 months. So when we come back next year to report to you, we're going to have some more findings to share. So this is our son, Jordan. He was a very intense soccer player, and Shelley and I miss watching him play. We ask for your help, and we can't do it alone, and it's going to take a lot of us to overcome this. But I think if we all band together, bring in the experts, continuing working together, I think we can overcome this. Thank you. And now I'll introduce Dr. Sandra Gompf.
Thank you. I'm Sandra Gompf. I'm here with my husband. Oh, okay, no problem. I'm here with my husband, Timothy Gompf. We're both physicians. I'm an infectious disease specialist and faculty at the University of South Florida. And my husband is a hospital pediatrician with Watson Clinic at Lakeland Regional. And all of the points that Steve just made are just things that I was going to reemphasize. That word rare, that's the R word to all of us. Every single parent that I've talked to that has lost a child to amoebic meningitis has said, why are they saying the word rare? The word rare encourages complacency and denial. And with something this scary for parents, it's so much easier to deny it. It can't happen to my child, it can't happen here. We've been swimming all of our lives and nothing ever happened. It's a disservice to the public. It's a disservice to parents. I've spoken to many parents who have been concerned about Naegleria fowleri in water and swimming in lakes, and they've come up to me and said, thank you so much for bringing awareness to this issue and making it easier for us to talk about it and to say, I don't want my child to swim in the lake, or let's use nose clips. That's a problem with the word rare. Infection due to Naegleria fowleri is uncommon, but it's highly deadly. It kills quickly. It affects almost uniquely young, healthy, active, vibrant people. And we can do something about it. Not only can we treat it if we catch it early enough, but it's so easy to prevent. It is so easy to prevent. There's only one way that you can get it, and that's an easy thing to prevent water from getting up the nose. I really am grateful to Florida Hospital for starting the care pathway with the alert that tells physicians to ask about water exposure. One of the things that I increasingly tell my house staff, I work at the VA in Tampa, is you cannot miss the travel history or the exposure history. You don't know what your patients have. We have a global society now. People travel everywhere. People go on eco tours and get exposed to a variety of things. There are people they have natural pools now where the pools are not chlorinated, and people just they're ignorant. They don't know what the risks are for that. So, and you know, all the cases that we've seen, almost all the cases that we've seen this year have been diagnosed in, well, they picked it up out away from where they were diagnosed. A girl who was infected in Maryland was diagnosed in New York. Sebastian was picked it up in South Florida, was diagnosed here. So it's very important to make the travel history a part of your evaluation on new patients every single time. Don't miss it. And not only international travel, which Orlando is, of course, very familiar with, but within the United States. There are risk factors for a lot of things within the United States. So ask about everything. I tell my house staff that our duty to our patients is to evaluate them and rule out what's likely, what's reversible, and what's life-threatening. If you address those three things, then you have done your duty to that patient and you're unlikely to miss something serious. Just because something is rare doesn't mean that you don't include it on that list. You have to address those things or you have not done that patient the service that you should. A few words about our son Phillip. In 2009, he went swimming in Lake Arietta with his cousins. He'd done it several times. About 5 days after he went swimming in August, he came down with a headache, which was a little bit unusual, but you know, kids get headaches. With summer, he wasn't getting any sleep. So we said, well, we'll keep an eye on you, and he didn't have a fever. I checked for a stiff neck, and he didn't have a stiff neck. So we let him go to bed, and then by the next morning, after I'd gone to work, and Tim came in to see him, and he had a stiff neck, and he was very sick. Long story short, it was probably about 48 hours from the time that he had a headache to the time that he probably was clinically brain dead. There was no time to do anything. And even if there had been treatment at that time, I don't know that we would have been able to diagnose him quickly enough. So that's my emphasis has been on prevention. Prevention is always cheaper and easier than treating illness. We have a Summer is Amoeba Season campaign. We started a few years ago, and it's funded by the Phillip Gompf Memorial Fund for Infectious Diseases. It was a USF Foundation fund that was graciously set up for us by my mentor, John Sinnott at USF. And part of the mission of that fund is to promote education in infectious diseases. And so that's what we've been doing with it. We have a website, amoebaseason.com, with all sorts of information and links for both public and health professionals. We have a series of digital billboards on I-4 in East Hillsboro, both northbound and southbound, or east and westbound. And those run from May to August. They just ended now. And I've had a lot of parents have come up to me and said, look, I'm really glad that I saw your billboards. They're really great. I'm glad that you're bringing awareness to this. So, a lot of views every summer. We have videos telling our story. We have short preventive social media video on YouTube and also online. We've got a social media presence, and from May to August, I'm always posting things about Naegleria fowleri, amoebic meningitis, water safety, swimming safety. All those things are important to us in the summer. So You know, Naegleria fowleri may be rare, or rather the disease is rare, but every kid is rarer than Naegleria fowleri. And it breaks my heart every time I see this happen to somebody, to another family, because their ramifications are broad. It's not just that family, it's that whole community. It's the rest of our lives. And we don't want that to happen to anyone else. So I really thank you for all for being here. I feel like I'm preaching to the choir. But I hope that you'll share the message and you'll share the knowledge that you acquire here, and that we can continue this work. Thank you.